I'm going to talk to you about importance of nutrition for young girls. Now, why is food so vital for young girls? Now, we all know that adolescence is considered as a nutritionally critical period of life, and stepping into puberty is an important milestone in reproductive life, and changes in the timings of puberty is associated with health and psychological problems. In less advanced economies like India, girls face challenges in identifying their true health and hygiene status. When the issues of health and hygiene status are not adequately addressed, the adolescent's self-awareness suffers and health and hygiene related problems result. Now here I'm going to talk to you about Barker's hypothesis. Actually, this is a pledge I've taken this year, and I've started CMEs to this effect, that I want to spread this message to the young girls, why nutrition is important for you. Barker proposed a hypothesis which says there's a three-generation effect of nutritional status on the individual. That is, nutritional status of the girl, her mother, and her maternal grandmother decides the fetal outcome. So what you eat today and what your mother ate when she was pregnant and what her mother ate when she was pregnant or periconceptual time is what is going to determine your your baby's fate. Now, this is a beautiful book on fetal origins of adult diseases by Barker. It was when I was studying in England that the hypothesis came up. It talks about programming of adult diseases in fetal life. The Barker hypothesis proposed the fetal in utero environment is a significant determinant of risk for major chronic diseases such as cardiovascular disease, stroke, paralysis, hypertension, type 2 diabetes, and obesity later in life. He proposed a relationship between birth weight and blood pressure levels, and that low birth weight babies who survive infancy and childhood might be at increased risk of complications later in life. So studies link maternal malnutrition during the pre-implantation period to abnormalities in blastula formation. He showed that there is a relationship between the intrauterine milieu and adverse postnatal consequences, and size at birth and diseases are known risk factors for coronary heart disease, including hypertension, type 2 diabetes mellitus, and hyperlipidemia. So fetal nutrition is a key regulator of the fetal growth. Both birth weight and placental weight are affected by the balance of macronutrients in the maternal diet. Imbalance of protein and carbohydrate during pregnancy is associated with reduced birth weight and increased blood pressure in the offspring. So if you have a look at this figure is showing you altered fetal nutrition is the leading cause, directly or indirectly, to altered growth and maturation of various fetal organ systems. So here you see on the top is altered maternal nutrition. And then if along with this is abnormal placenta or altered uterine blood flow, it causes altered fetal nutrition, leading to delay in the phase of development of the fetus, leading to altered organ growth and maturation. So what is happening is, because of altered growth and maturation, the liver size is affected. So there's going to be increased gluconeogenesis, decreased lipid metabolism later on, which will be showing in form of hyperlipidemia. The pancreas will be affected, the muscle size will be affected. So there'll be decreased insulin secretion, decreased insulin sensitivity to the tissues, and leading to impaired glucose tolerance, leading to diabetes. Then hypothalamic pituitary axis will cause increased cortical secretion. The kidney size will be small, that is, there will be the reduced number of nephrons, and the vasculature will be affected, the heart will be affected, the number of biocytes will be affected, leading to hypertension and stroke later in life, and the whole milieu is going to cause coronary heart disease later in life. So therefore, a future adolescent pregnant mother should take healthy and balanced diet for normal development of the fetus. Now, according to the National Family Health Survey, in the age group of 15 to 49 years, 53% of non-pregnant women and 50% of pregnant women and 58.5% of children in the age group of 6 to 59 months had anemia. Another study conducted in 16 districts of the country reported the prevalence of anemia as high as 84.9% among pregnant women and 90.1% amongst adolescent girls. Undernutrition and anemia affect over 50% of adolescent girls in South Asia. In India, 45% of adolescent girls are underweight and 56% are anemic. Childbearing occurs mostly at ages between 15 to 25 years, when Indian women are most likely to be either underweight or anemic or both. So average weight gain is approximately during pregnancy 7 kilogram for a full-term pregnancy, which contributes to a high incidence of low birth weight, wasting, and stunting in their children. So if you have a look at this figure is showing you slow decline in prevalence of underweight and anemia amongst adolescent girls in South Asia over the past 10 years. And here is the prevalence of short stature amongst us. And here is the prevalence of overweight and obesity in South Asian girls, adolescent girls. And this publication has shown that only 20 to 40% of South Asian adolescent girls meet the recommended dietary intake, which means most of them are malnourished. Energy intake is mostly obtained from carbohydrates in the form of cereal, grains, roots, and tubers, and protein intake is low, which is really, really important for for a growing girl. 40 to 70% of girls consume less than 50% of recommended dietary intake in the form of meat, chicken, dairy products, or fish. So food insecurity, dieting, and illness can impair growth and development during adolescence. Now, while planning food, one should take into consideration 6 common conditions which are prevalent in the general population, like anemia, micronutrient deficiencies, particularly zinc, because zinc is very important for growth and development, hypertension, diabetes, increasing obesity, and now growing incidence of kidney disease because diabetes is becoming rampant, and worm infestation. Now, everybody knows about anemia. Iron deficiency anemia is the most common and widespread nutritional disorder in the world. And according to WHO, anemia is a public health problem when the prevalence is more than 20%. And what does it do? What does anemia do? Anemia causes cognitive performance behavior. It affects cognitive performance behavior. There is increased perinatal risk for mothers and neonates and increased overall infant mortality. Anorexia, it causes anorexia, loss of appetite, and affects physical growth. So how would you prevent anemia? Well, you have to increase intake of iron-rich foods, lean meat from fish, poultry, and non-animal foods like legumes and green leafy vegetables. These are very, very important for girls. Bioavailability of nutrients is an important determinant of disease caused by micronutrient deficiency. How? I'll show you now, later. So, phytate is an inhibitor of iron absorption. So one should avoid taking iron supplements with foods rich in phytates. Here you see phytates are present in cereal bran, cereal grains, high extraction flours, legumes, nuts, seeds, iron binding phenolic compounds. So you have to be careful when you're taking iron-rich food, you should avoid taking these kind of foods. Then tea, coffee, cocoa, herbal infusions, in general, certain spices like oregano and some vegetables and calcium, particularly from milk and milk products, are inhibitors of iron. So you should avoid taking iron with these kind of foods. And then there are some enhancers also of iron absorption, like heme iron present in meat, poultry, fish, and seafood, ascorbic acid or vitamin C present in fruits and fruit juices, potatoes, and some other tubers, vegetables such as green leafy vegetables, cauliflower, cabbage, and some fermented or germinated food. These are enhancers of iron. Why fermented or germinated food? Because fermentation and germination reduces the amount of phytates. So you should include fermented foods in your diet, and so that you can have a better absorption of iron. To supplement iron, if anemia is documented, use fortified cereals and increase intake of heme iron products like meat, liver, poultry, fish, etc. Now, zinc, is a very, very important trace element because it is involved in the proper functioning of more than 200 metal enzymes. It is important for growth and development, to boost immune function, to promote protein synthesis, DNA synthesis, and wound healing. So here, this is a very good study which has shown that populations subsisting on plant foods are believed to be at a high risk of mineral deficiencies. Diets of Indian schools, this is from South India, are deficient in zinc, and there are a lot of studies from South India which are showing that girls are deficient in micronutrients. So what they have done is they have prepared zinc-rich recipes, and then they have supplemented these to the girls, and they found that the bioavailability of zinc, which was seen as dialysable zinc, was really had grown 5 to 8 times higher than the regular meals. So intake of whole grains, leafy vegetables, sprouts, milk, fruits with were inadequate in the diets of these girls, suggesting dietary deficiency of macro and micronutrients, particularly beta-carotene, vitamin C, iron, and calcium. So remember that zinc content of the food varies with the moisture content. The higher the moisture content, the lower is the zinc content. So here, what they used was they used sesame seeds and groundnuts to prepare sweets. And these were, they increased the bioavailability of zinc by 5 to 8 times. Then they use fermented foods like rice with pulses and vegetable idli with spinach paste and wheat bread with vegetable sandwich and spinach paste. So everything increased the bioavailability of zinc in these girls. And carotene, the beta carotene and vitamin C and iron and calcium content also increase in the diet with supplementation. And remember, the study has shown that a supplement of 200 grams of cereal-based recipe, which is equivalent to one meal for a girl, can fulfill 75% of the daily zinc requirement of the adolescent. So you should take cereal-based recipes. That will be really, really good for you. And what are the sources of zinc? Well, seafood and sea almonds are really rich in zinc. Cashews, spinach, red beets, pumpkin seeds, sesame seeds, mushrooms, lentils, which are fortified cereals with like bran, whole grain, and multigrain cereals. These are rich in zinc. Even mushroom is very rich in zinc. Now, iodine is very, very important. And the reason I'm talking about iodine here is that we use iodized salt, which is the only way to supplement ourselves, because I don't think that iodized oil worked, edible oil could do much of this job. But remember, 40 to 70% of iodine is lost in cooking, even when you're cooking with iodized salt. So you have to depend on other things like egg or seafood for getting iodine in your diet. And here, for your benefit, you can see what deficiency causes what is the effect of various vitamin deficiencies in the body. So here, the vitamin A deficiency, this is what is happening: corneal ulceration, the xerophthalmia here, dryness of eyes, or vitamin K deficiency. There's eye hemorrhage, or you can see the bruising of the arms and here you can see there is these are curved or bowed legs because of the vitamin D deficiency. Here, this is in adults, it is called osteomalacia. In young children, it is called rickets. Here you can see, well, iodine, I said, is very common. Deficiency is common. And so you have a lot of hypothyroids here. And here is this goiter that you can see. Vitamin B complex is extremely important. And remember always that grains and cereals are very rich in vitamin B6, but don't use processed food because you tend to lose vitamins in this. So here you have angular stomatitis. It's quite painful, these angles of the mouth you can see here. And here you can see vitamin D deficiency leads to periodontal disease. This was very common in sailors at one point of time. It was called scurvy. And vitamin C deficiency here, as you see, so these gums and everything, this is called gingivitis. And here we can see anemia. Of course, I've talked about anemia. And this is, you see kind of a decorated person, but this is actually wearing a necklace of deficiencies. That is, these are the lesions because of vitamin B3 deficiency, which causes thickening of skin here and here, and inflammation. It's really a bad condition. And here you see this is dry beriberi, which is because of a vitamin thiamine deficiency. So you see the patient is so emaciated. He's got paresthesia. This got wet beriberi, where this person is edematous, swollen, and everything. It works on your mind, neural. So it's very, very bad. And here you see the neural tube defect, which develops because of the deficiency of folic acid in periconceptional women. Remember that by the time a woman misses her first period, the neural cord, the neural tube has already reached its fate, whether it's going to close or not close. So if the woman is deficient in folic acid, this kind of a scene can appear, and this is very painful for the mother to have a child with the neural tube defect. The child's going to have multiple surgeries depending on how serious the condition is, like this one here. So what is a small message here? Add water and fat-soluble vitamins to the diet. And from where do you get them? You get them from cereals, grains, fruits, vegetables, dairy products, poultry, vegetable oil. So colored fruits and vegetables meant for vitamin A, cereals and grains for vitamin B complex, citrus fruits, Indian gooseberry for vitamin C, dairy products for both fat-soluble and water-soluble vitamins, fresh fruits for folic acid. Remember, fresher the food, higher will be the folic acid content, meat and flesh foods, and for vitamin B12. And so those who are vegetarian, they should take vitamin B12. It's important. And it's not very expensive to get this pill. And you have beautiful hair, you have shiny face when you take vitamin B12. So do not miss this pill. And then eggs and butter are a must for all the growing girls. Fish oils, leafy vegetables, vegetable oils for vitamin E, then spinach, broccoli, and canned, tofu or sardines for calcium, and green leafy vegetables for vitamin K. So remember these the way I've presented it, that you do not forget. So processed cereals, as I mentioned earlier, have reduced content of vitamin A. So you should avoid this. I'm not going to go through this table because it is a long table. But anyways, I've told you the gist of from where to get your vitamins. Now, DHA is essential for brain growth, and omega-3 fatty acids supplementation should be at least 200 milligrams per day. And you get omega-3 fatty acids from our friend cod liver oil. If you are a vegetarian, then you can have 7 C's, as it is called, at least 2 to 4 capsules a day. And otherwise, you can take fish every day, or at least twice or thrice a week. And people have this misconception that that vegetable plant foods have omega-3 fatty acids. No, it is actually omega-6 fatty acids that they contain, and they are actually fortified with DHA. Like flax seeds are fortified with DHA, then you have plenty of omega-3 fatty acids. Chicken is a good source, and of course DHA enriched, everything that is enriched with DHA, one should go for it. Now, this table is showing you the protein requirement for boys and girls. For girls, it is 0.86 grams per kg body weight per day. For boys, it is 0.88. And for girls, the energy requirement is 51 kilocalories per kg body weight per day, which is a lot more than what was in the previous recommendations of NIN. And these are the foods from where you can get protein of high biological value. See, you have proteins in everything. You have protein in everything. Even in banana, you will get protein of 1 gram for 100 grams. But then is it of a high biological value? No. So animal products are having proteins of high biological value, and also soy products have protein of high biological value. And particularly, and if you have chicken, fish, and egg, you get very good protein of high biological value. And this is the same table. Now, overweight and obesity have become serious implications on future health risk factors and have become major problems since 1980s amongst our children and adolescents. So what are the implications of obesity? You get high blood pressure, high cholesterol, heart disease, diabetes, then you have arthritis, respiratory disease, depression, and low esteem. So the prevalence of diabetes in children and adolescents is increasing worldwide. Obesity is caused due to complex interaction between biological, developmental, behavioral, genetic, and environmental factors. So remember fast foods, remember Domino's, remember pizza, and you know that you adding excess of calories to your system. So obesity is affecting about 3% to 24% of adolescent girls in South Asian countries because of one is sedentary behavior, because we are too glued to our tables and we are too glued to the television. So we are not very active, and then easy access to all kinds of foods. The multinationals have come to India, Burger King and everything, and you are eating all these, which is delicious, but yet a junk food. So this is fully integrated into the modern lifestyle, making a positive energy balance difficult to counter. And people, remember, have a natural inclination to conserve and build energy stores. So one has to be very, very careful with this. Now, if the mother is obese and she starts a pregnancy, when she's obese, she is at an increased risk of complications during pregnancy or delivery, which could also result in a premature delivery and a low birth weight for her a baby. So one has to be very, very careful. So consumption of fast foods and foods high in fat, sugar, such as chocolate, cakes, pastries, ice cream, biscuits, and sugary drinks should be discouraged. One should reduce sugar and refined carbohydrates and prefer low fat restricted carbohydrate diets. And if you have a look at this table is showing you the study is on energy balance in adolescent girls. What these people have done is that they did accelerometric, estimation of energy expenditure, and they found that if you introduce lightweight exercise, and also restrict your diet, the BMI comes down and the body fat percent also comes down. So one has to reduce total saturated fats, increase fiber content with more grains, vegetables, fruits, and legumes. Now, I'm not going to discuss much about gut microbiota and obesity. This is my favorite topic, gut microbiome. I'm really, really into this thing. But the reason I'm going to talk about is I just want to tell you to introduce probiotics in your diet, and probiotics you get from your friend yogurt. Yogurt is done in India at home. So it's not that you have to buy it from the market. You buy it from the market, you do it at home. So yogurt is something, a great friend of yours. At least have it twice a day. Pickled cucumbers are a very good source of probiotics. Tempeh or cottage cheese or kefir, a fermented milk beverage, or a kimchi, which if you get it in mainland China, it's so delicious. It is all full of cabbage, radish, and scallions. So this is a very good source of probiotics. Do introduce probiotics in your diet. Now, a prevalence of diabetes in children and adolescents is increasing worldwide. Predisposing factors for diabetes are obesity, family history, and sedentary lifestyle. Now, so what is important for me to tell you here is, please introduce lifestyle changes like increasing physical activity at least 5 days a week. It is very, very important for you to keep diabetes away. Now, high blood pressure in children and adolescents is a growing health problem that is often overlooked. Systemic hypertension is an indication of an underlying pathophysiology in childhood and adolescence, which, if not controlled effectively, could result into increased risk of myocardial and cerebral infarctions in adulthood. So studies have shown hypertension in early adulthood age has its roots in adolescence. So if you have a look at this figure is showing you there is a prevalence of increased prevalence of CVD risk factors like high fasting blood sugars, deranged lipid profile, and high BMI. All these things are high risk factors for CVD. It's coronary vascular disease, cardiovascular disease. Now, we know that although most of the diagnosed hypertension has no obvious direct cause, dietary salt or sodium has been implicated to be an important etiological factor. So salt is now branded as a dysfunctional food. So if you have a look at this figure is showing you that the blood pressure is directly proportional to the total sodium content, and the usual sodium intake is between 3.5 to 5.5 grams per day, which corresponds to 9 to 12 grams of salt per day globally, which means that you're taking a lot of salt. Excessive sodium consumption of more than 5 grams per day causes increased fluid volume and consequently hypertension and the rise in systolic blood pressure with age. And remember that as age increases, your sensitivity to sodium also increases. So a person who is between 20 to 29 years of age, and if he's taking, say, 100 mmol of sodium, the increase in systolic blood pressure would be 5 millimeters of mercury. But if the same amount of sodium is taken by a person who is between 60 and 69 years, I'm not showing you that slide, I deleted it, but I'm telling you that the same amount of sodium will increase systolic blood pressure by 10.3 millimeters of mercury, and the corresponding diastolic blood pressure will also go up. So a 5 gram per day higher salt intake, that is 2000 milligrams of sodium, is associated with 17% greater risk of total cardiovascular disease, and crucially, a 23% greater risk of stroke. So therefore, restrict salt to 5 grams or less than 5 grams per day, which is equal to 1 level teaspoon of salt per day. According to AHA guidelines, American Heart Association says 6 or more servings of grain products, including whole grains, as major sources of calories in diet from food high in starches like bread, pasta, fortified cereals, potatoes, are recommended over sugar, and this should be followed. and include soluble fiber in diet to reduce total and LDL cholesterol, because every gram increase in soluble fiber decreases LDL cholesterol by an average of 2.2 milligrams per deciliter. And so you should take a lot of SAG and all those things. Now, limit dietary cholesterol to less than 200 milligrams per day. Total fat intake should be less than 30% of total calories. But if a patient is hypertensive, then less than 20% of total calories. Trans fatty acids should be less than 1% of total calories, and saturated fatty acids less than 7 to 10% of total calories. Now, restrict full fat dairy products and tropical oils. And well, if you have a look at this figure is from Omni Heart study, which says that when carbohydrates are partially replaced by unsaturated fats, predominantly the monounsaturated fat, it lowers blood pressure, triglycerides, and increases HDL cholesterol. And here, these are the recommendation of National Institute of Nutrition 2020, which are telling you about the correct use of oil. One should use a combination of oils. Say you take 2 or 3 oils and make one dish per oil, so that you get all kinds of good things from the oil. So the best combination is when you combine groundnut oil with sesame oil or mustard oil. Mustard oil is really good for us, or rapeseed oil or rice bran oil. So these are combinations that you should keep on changing over a period of time. And so how much fat should the girls and the boys take? It should be between 35 to 50 grams per day. But if you are obese, then you must bring it down to less than 30 grams per day. So the dietary strategies for prevention of hypertension are reduce sodium intake, because a lot of sodium comes in the form of hidden sodium in the food, especially the processed food. So you should be careful while consuming this. High consumption, do try and adopt DASH diet. I'll talk about Mediterranean diet in a minute. So Mediterranean diet is really, really good. Increase potassium intake by taking more of fresh fruits and vegetables. And the content of calcium and magnesium intake should be normal in your diet. So a healthful eating pattern should include complex carbohydrates, fiber, calcium, and antioxidants such as vitamin C, E, and carotenoids. So here, this is the Mediterranean area. And why is Mediterranean diet so popular is because the incidence of hypertension and cardiac disease is low in the Mediterranean countries, which is actually ascribed to the use of, first of all, the extra virgin olive oil, and 2, there's abundance of legumes cooked regularly in tomato, garlic, and onions. And the key characteristic of this diet is that it is low in trans fats and saturated fats. So here is how a Mediterranean diet looks. See, this is plenty of fruits, plenty of vegetables, bread and cereals. Then you have olive oil, which is the most important thing. And here you have sprouts, and you have poultry, you have a fish, then seeds, a lot of nuts, lots of nuts, and eggs. And you can, in India, replace olive oil with mustard oil, because we are talking about monounsaturated fatty acids. So mustard oil is about 60% monounsaturated fatty acids, so you can use mustard oil, right? And fresh fruits undergo minimal processing, hence they are rich in fiber, antioxidants, polyphenols, which confer vasoprotective effect. Now, this is a study which is showing, this is a systematic review of dietary intervention, which is just telling you that educate adolescents, that will increase their nutritional knowledge. And so they will start taking more of whole grains. They will take more of vegetables, dairy intake, skim milk consumption will go up. So it is basically the lack of knowledge. And this is what is the purpose of this CME for over the next 5 days, that we'll be telling you how best to learn about nutrition, the proper way of feeding yourself, so that you neither become hypertensive nor do you become obese. So the take-home message of my talk here is that girls should take proper nutrition in order to lead active and healthy life and be able to prevent giving birth to underweight babies for normal organogenesis and to prevent risk of cardiovascular disease. So this is a pyramid which has 1, 2, 3, and 4 floors. The base floor is the most friendly floor, which is, it says, you take me in plenty, that is 5 to 6 servings of grains, then 3 to at least 3 servings of vegetables, and 4 to 5 servings of fruits, then 2 to 3 servings of meat, fish and veg and eggs and alternatives, 1 to 2 servings of milk and alternatives, and a minimum amount of fat, oil, and salt and sugar. So I'll leave you with this message: eat a variety of foods, grain products, vegetables and fruits, low in fat, saturated fat, and cholesterol, moderate sugars and salt, a diet that provides enough calcium and iron to meet growing body's requirement. Add probiotics to diet. Yogurt is a good friend of yours. Balance foods with minimum of 30 minutes daily of daily physical activity, which will prevent you from becoming overweight and obese. So thank you for your attention.